Good day, I am Dr.K Gireesh, physician, neurophysician and neurosurgeon. This is the RNA series number 71. Random RNA is nothing but random questions in neurology and neurosurgery with answers by Dr.K Gireesh. This is to benefit the practitioners of neuroscience and the medical field for a lifelong learning and also for public awareness. In this series, the question that I am addressing is, what is Adam's triad or the Hakim-Adam triad? It's a triad of the symptoms of the normal pressure hydrocephalus, including the gait apraxia, incontinence and dementia. In normal pressure hydrocephalus, the term Adams refers to Raymond Delsey Adams, R.D. Adams, a famous American neurologist from Massachusetts General Hospital and the Harvard Medical School. NPH or the normal pressure hydrocephalus is often called the Hakim-Adams syndrome because it was described by Salman Hakim, a Colombian neurosurgeon, and Raymond Delsey Adams, American neurologist and a co-author of the classical textbook of Adams and Victor's Principles of Neurology. They, along with the colleagues, described the syndrome in 1965 as symptomatic occult hydrocephalus with normal CSF pressure and published in the New England Journal of Medicine. The classical triad is often called as Hakim-Adams triad or Adams triad. Now, who was Salman Hakim and how did he discover NPH or normal pressure hydrocephalus? Salman Hakim was a distinguished Colombian neurosurgeon and scientist, known worldwide for discovering the normal pressure hydrocephalus. And Hakim's discovery began with a clinical observation in a patient following head injury during the late 1950s or early 1960s. The patient had a history of trauma, head trauma, and following which there was a progressive difficulty in walking, mental slowing or cognitive decline, and urinary disturbance. Investigation showed an enlarged cerebral ventricles, hydrocephalus. However, there was an apparent paradox. The CSF pressure measured by lumbar puncture was not markedly elevated. At that time, hydrocephalus was generally believed to be or require a raised intracranial pressure. Hakim reasoned it out. Pressure alone may not explain the ventricular enlargement. He applied a physics principle. Pressure is equal to force by area. As ventricles enlarge, the same pressure can exert greater total force over a larger ventricular wall surface. Thus, CSF pressure may be normal, yet ventricular enlargement and the brain dysfunction may still occur. This became known as the Hakim's hydrodynamic concept of normal pressure hydrocephalus. Hakim performed CSF drainage for these patients and later a CSF diversion procedure. He observed improvement in gait, better cognition and clinical recovery. This was revolutionary because it showed that some forms of dementia and gait failure, which has been attributed to degenerative disorders, could be surgically treatable. Hakim-Adams collaboration, or Hakim later worked with Raymond Delsey Adams and colleagues. Their landmark paper in 1965 described the symptomatic occult hydrocephalus with normal CSF pressure. This established the condition internationally as Hakim-Adams syndrome or the normal pressure hydrocephalus. The classical Hakim-Adams triad include a gait disturbance, cognitive impairment, urinary incontinence. The gait disturbance is often the earliest and the most prominent. A magnetic gait, difficulty in initiating the steps, short shuffling walk, and the cognitive impairment is a slowing of the intellectual components, executive dysfunction, and dementia-like symptoms. That means dementia is nothing but a global loss of intellectual functions, thinking, understanding, reasoning, learning, memory, and all that. Urinary urgency and incontinence. Now, I told you about magnetic gait. Now, what is a magnetic gait? The patient's feet appears to be stuck or glued to the floor, as if attracted by a magnet. They have difficulty in initiating the walking and lifting their feet. A classic bedside observation is a patient standing up with effort, taking short, hesitant steps, and appearing unable to lift the feet normally from the floor, hence the term magnetic gait. In normal pressure hydrocephalus, enlargement of the ventricle stretches and disrupts the fronto-subcortical pathways that control the gait initiation and postural control. The problem is primarily a higher level gait disorder rather than a weakness, sensory loss, or cerebellar dysfunction. In fact, the patient often says, I know how to walk, but my feet won't move. It feels like my feet are glued to the floor. The gait disturbance, the clinical significance of this is very important. The gait disturbance is usually the first symptom to improve after CSF drainage or shunt surgery, making it an important marker when assessing response to treatment in normal pressure hydrocephalus. Well, Hakim, the Colombian neurosurgeon, is remembered because he demonstrated that not all dementia is degenerative. Some patients with ventricular enlargement and gait disorder may improve with shunt surgery. This changed the field of neurology and neurosurgery profoundly, especially in the arena of degenerative disorders. A lovely scientific references are there and textbooks, especially Adam Z. Victor's Principle of Neurology, that chapter on hydrocephalus, Merritt's textbook of neurology, normal pressure hydrocephalus chapter, and also Humans' latest edition in the chapter on hydrocephalus explains on the NPH very well. Thank you very much.